Hi, this is Dr. Jamie Skipper from Elevation Health Consulting. We're here at the Digital Health Summit at CES 2020, and I'm here with Suraj Kapa. Dr. Suraj, Kapa, it's so nice to have you here. You're from the Mayo Clinic, and you're the Director of Augmented and Virtual Reality, AR/VR. Tell us about that. Tell us what you're doing there. What are the things that you are really trying to accomplish at the Mayo Clinic? And maybe start a little bit with the history of Mayo coming up with this new department.
Thank you. Thanks so much for having me here. The concept of innovation in medicine isn't new. The truth is, physicians and clinicians who encounter patients every day have been the underpinnings of medical innovation, of realizing what the needs are and what the gaps are. And within that space, actually, Mayo, for the last 150 years, has been one of the most innovative hospitals in the world. Everything from heart-lung machines, through the pneumatic tube system to share medical records, through a homegrown electronic medical record system. All of these inventions were meant to allow us to take better care of patients. But in order to do that, we need to systematize the processes. And that's why we created these separate divisions in order to facilitate the translation of physician insights into actionable products that can actually improve patient care.
So tell me about a story about some of the most interesting products that you've been working on, and maybe a story about a patient or an individual that's been really impacted by some of the work that you've been doing.
So we've been trying to advance our use of newer computational technologies and methods, such as the buzzwords that we all hear about: machine learning, big data, artificial intelligence. But what we've been understanding is that we can gather insights from data that's been around for over 100 years that are fundamentally unique. We've been able to show that with an electrocardiogram, we can determine how old somebody is, but not just how many years have passed since they were born, what their chronologic age is, but what their biologic age might be, what their physiologic age is, how many years they might have before they die. And we can understand if somebody might have a low heart function but might not be feeling it yet. And by using these technologies, we can go to patients in the community and get very simple form factors of an ECG, which you can get through all of these wearables and other technologies, just from somebody just walking by. And by doing that, we can actually tell them, hey, you might have something going on. You need to probably see a physician.
Tell me about a specific device that you guys have been using this year that's had some amazing impact, that's been really making you excited about what you're doing there at the Mayo Clinic.
So it's really employing a lot of these algorithms that we've been developing through existing devices. And by doing that, we've been able to show that we can reach the community, not just the people coming into our brick and mortar clinic.
Well, that's interesting that you brought up community, because it's really about bringing the data together and making sure that you can see the whole patient and really diving into their story and making sure that the treatment that you're giving is relevant to where they are. So that's really exciting. You've been here at CES before. Is this your first CES?
This is my first CES.
What do you think?
I think it's phenomenal, the amount of technology and the amount of shared decision-making and knowledge that exists here.
It is pretty amazing. Tell me one of your favorite things that you've seen outside of what you're doing here.
I think one of the most amazing things I've seen is the rapid translation of technologies such as augmented and virtual reality solutions and computing solutions that are actually going to allow what I do to be easier to take it to the home. And that opportunity is what's really going to allow us to offer healthcare to all.
Well, it was really great to have you here, Dr. Kappa. And here we are at the Digital Health Summit at CES 2020. This is Dr. Jamie Skipper, and it's wonderful to have you here and share with us what you're doing at the Mayo Clinic.